have very, very elaborate hearing aids, which cost $2,000 or $3,000. So there are lots of advances happening. And the children that are currently affected in every village can be treated. First, if you don't measure it, you don't know it, then you can correct it. And that's why the screening and then determination of the problems at the high school student level or primary school student level is very important. So we talked about U5MR. We talked about creating 8th grade MDs on very narrow subjects like pregnancy, delivery, and various other things. And they only know that one subject. They've been trained and verified and certified. But they still, and the government provides free medicine already. So the final one I want to tell you about is what is called emergency medicine. Until 2005 or 6 or 7, India had no 911 service. If you had an emergency, there's nothing you could do. Then a not-for-profit entity called EMRI created the technology and the management and demonstrated it in one district to provide ambulances on demand. Since then it has spread to two-thirds of the country, I believe, are using it. And the key component is a public-private partnership. It was discovered that government cannot run ambulances. If the people won't go, and you may pay the driver, but he won't show up. But if it's a private party, and they're managing it, so the private sector provides technology and management, and the public sector provides the ambulances and the people and the salaries and all the other things. And the cost is mostly in the public sector. 95% of the cost is providing the ambulances and people, medical technicians, and all of the medicines and so on. But now I can tell you, in USA, 911 service essentially takes, is fragmented. If you might have an ambulance right next door, but it's in another county, therefore you don't have access to it. Whereas in India now, there is a single number, 108. Everybody calls that number. And the computer technology magically decides which ambulance should go there. And it is known among doctors, emergency medicine, if you can get the ambulance to the accident site and provide immediate help, 80% of the deaths can be avoided. So the difference between taking 1 hour to get there versus 10 minutes to get there is you save 80% of the people that die. In India, in automotive accidents, the last time I looked at is at least 250,000 people every year. And it may be more, my numbers may be off. I also heard 1 million deaths globally in accidental deaths. Insofar as you can provide, so basically it's the technology that we have created, the digital technology, can immediately help in these 4 areas. For providing access to knowledge and information, in the case of U5MR or for the parent, providing education to create technical medical technicians in every village, because right now this screening National Health Mission is completely bogged down because they're expecting people to go somewhere and then there are all kinds of things are happening. I still don't understand why not single screening has done in the schools, but that's a different problem. But you can solve that problem at this point. And if you can screen the people and then decide what problem they have, you can immediately provide a solution. That's the beauty of it and the technology of this. And you will be able to know whether the doctor speaks your language or some other language, doesn't matter. You can speak in Telugu and we can speak in Hindi, it doesn't make any difference. You'll be able to talk to each other. And this is a problem that the Ministry of Information Technology, MIT, is working on right now, I know. And I'm hopeful that they will solve this problem very soon. And emergency medicine, again, can have a huge impact on people that are pregnant and having children in delivery versus accidents, all kinds of things. And getting the right ambulance to the right place in the right time and speaking the right language turns out to be lifesaver. Thank you very much, and that's all I wanted to say.
Thank you. I wanted to hear from you, ladies and gentlemen, here for Dr. Reddy, who based on our request from India, got up at 1 a.m. in the night in US to address all of us. And sir, thank you for covering so comprehensively, talking about the potential which mobile technologies offer to us, the ongoing Indian program of Rashtriya Bal Swasthya कार्यक्रम, wherein we are focusing on screening of children for birth defects and providing them solace and support in terms of hearing aids and classes, and how power of technology can be used and leveraged to support that initiative in a big manner. Sir, you comprehensively covered about the emergency response system 108 ambulances which are now crossing across the country and supporting people in terms of the golden hour and saving lives. Sir, so thanks a lot, sir. It is a pleasure. On behalf of all the participants, let me convey my sincere gratitude and thanks to you. Thanks a lot, please.